Pete Craymer. I'll be turning 68 in about 2 weeks. Kind of a sports fanatic, coming all the way up from high school, played soccer and high school and college, and then in a men's league down in Charlotte. Snow ski, water ski, bike. Used to run quite a bit. Been married 43 years. I've had quite a few operations. Probably about 5 years ago, I went and had a partial replacement done in my knee, which allowed me to continue doing some of the sports that I wanted to do. I still couldn't play soccer or tennis and had to cut back on the running. And then skiing this past year, I took a pretty bad fall and out west, and it was time to get something done. So actually I was out at Alta in March of last year. Was having trouble getting an appointment to have an orthopedic doctor look at my knee. I ran into a friend who had a friend of his with him who actually was a supplier and worked with Dr. Boston on providing, I think he sells the knee parts and all the components and everything. And he was able to get me in to see Dr. Boston early May, and had my surgery on May the 5th.
So Pete's a very active individual, came to us with increasing knee pain. He'd been struggling with knee pain for a long time, and he felt like this could endanger his ability to continue to ski and be active. Pete had very severe knee arthritis. We talked to him about perhaps proceeding with a knee replacement, and we talked to him about doing a smart implant in his knee. You know, Pete's the kind of person we really want to see how he can do with this knee replacement, what kind of cycles he can take the knee replacement through. And so we implanted a smart implant in Pete's knee replacement. This gives us the ability to monitor him remotely. We can check in on him every day, see how many steps he's taking, see how fast he's walking. We can see how he does with stairs. We can even see how he does with knee range of motion after surgery.
Surgery was good. We had surgery at Catawba and spent one night and then came home. Felt great until the kind of the pain meds wore off, but the recovery was tougher than I thought it was going to be. Everybody says I'm a little more demanding and expect a little bit more than what I should be expecting. So I was anxious to get back on the bike, get back in the pool, you know, doing those things that I wanted to do.
Pete has a bedside station that his knee replacement communicates with every night, and then that's transmitted over the internet to basically a website that we access that's secure, and we can compare all of his data to all of the benchmarks across the country. We can compare him to other patients who have had similar arthritis to him. We can see how he's doing in terms of his activity levels after a knee replacement compared to anyone else in the country who's had a similar knee replacement. This is the first smart knee replacement in Hickory and even the region.
I started biking. Actually, I got on the stationary bike well before, probably 2 weeks out from the surgery, just trying to, you know, get some motion going. But at 6 weeks, I was able to get on my road bike and ride. I was able to get in the pool and swim. I was still going to PT at the time. As far as I can feel and experience, I have no restrictions. I'm able to get out and ride. I ride 3 days a week, about 30 miles a day, 30 miles each time. Swim 3 times a week, go hiking in the mountains.
We've done a handful of smart implants, and they're going very well. I think one of the interesting things about smart implants is historically, we see patients at specific intervals after surgery. Let's say 2 weeks after surgery, 6 weeks after surgery, and then maybe 3 months after surgery. We have no idea what they're doing in those intervals. Sometimes patients are doing very well in the beginning, and then they drop off. You know, their progression just stops. We don't really have a way to monitor that until they come into their clinic visit. And sometimes we realize, hey, this patient sort of had a hiccup 4 weeks ago. It would have been nice to have intervened at that time, as opposed to now we're a little bit behind the 8 ball. Now we have real-time live data from these patients to see how they're doing.
It was just overall, it was a great experience. Catawba Hospital was, you know, head and shoulders. I mean, it is more than I could have asked very responsive to us, very attentive to our needs. I mean, we were there just a short while, but I mean, it was really great care that I received there at Catawba. And then Dr. Boston with the surgery, I mean, he came and saw me that night, you know, after the surgery, saw him post-surgery office visit, and then the PT here was great. I mean, it was, couldn't ask for more. I mean, they're very attentive to me. What, you know, they knew I was pushing it, but they were right there with me. And I even came back and visited, you know, after 6 weeks, and they were very open to, you know, letting me come in and visit with them. So, I mean, I couldn't ask for, you know, from a hospital, from a doctor, from a PT standpoint, everything right here. I mean, the convenience of it was great, and to get that level of care was really, it made me feel good about what I did.
We have the patient who's doing very well and knows they're doing very well. We're not worried about that patient. We have the patient who is doing maybe not as well as some other patients, but they think they're doing well. That's the patient I worry about, because they don't let us know that they're not doing well. They don't let us know that they're having a little bit of issue. That's the patient that I need to see more often, that we need to intervene. We need to do more intensive physical therapy, and we need to have tailored therapy and tailored exercises. And that's really where I think that this knee replacement shines, is that we know exactly who is behind, and we know exactly when it happens. And so we can bring them in, we can intervene, we can get them to where they need to be. It's too late to find out 4 months after surgery that a patient has had trouble with motion all along and we didn't know about it. That's too late to find that out. And this knee replacement really helps us prevent that situation.
I'm looking at them more right after surgery, especially during the PT time. I was exceeding any kind of norms with my data. And so I kind of cooled my jets a little bit on looking at the data. You know, as far as people saying, "Whoa, you got a chip in your knee. How's that chip in your knee doing?" I can't even tell it's there. You know, and the data collection point was, I mean, it was just completely hassle-free, because I had it, whatever the device is to capture the data. I think it was set for 2 o'clock in the morning, right beside my bed. I mean, I never had to do anything, because it was all seamless. The guy came in, came up to the house, set it up, showed me how to log in and everything. I mean, it was very, and I'm technologically challenged, so he made it very easy for me to look at the data and, you know, read it, and then also how to maintain the device that was capturing the data at night. I'm doing everything that I want to do, and without any pain. I should have done. I mean, everybody was telling me for years. My brother and I'd be out skiing. He said, "Pete, you need to get your knee done. You know, you need to just," because he'd had his done. He knew what it was, and I kept asking him. We'd be on the chairlift, and I says, "Well, does that hurt when you do that?" Because it was hurting me. And he's like, "No, I'm fine. I don't have any knee pain." And he says, "You know, I'm not taking the ibuprofen like you're taking it." So absolutely, I would definitely encourage people to do it sooner than later. Dr. Boston came highly recommended by quite a few people that I talked to, and I feel like I got as good or better care here in Hickory as you might get in Charlotte, Raleigh, Winston area. And then the PT people here were just phenomenal. Thanks to everybody at EmergeOrtho, I just really appreciate it. Feeling good, ready to give it a try on the slopes.